All right. Thank you. So I think you remember that last time we were discussing about the materials, their biology, and their pharmacology. And I was telling you that how we are making these cements, what chemical and other ingredients we are um, mixing and making different types of material. In that, we discuss about this, that about cements and about endodontic materials. And when we say, and I talked about this, that there are only two materials in dentistry. One is a neutral material, and we call that this is a zinc oxide, and other one is the calcium hydroxide. And in that, we need to add some other materials to achieve um, basics, to make them convenient in use of in dentistry, their use in dentistry. So in that we have already discussed what are the antibiotics and what are the antiseptics. Can I ask my students that whether they can tell me that what is a antibiotic? What are the antibiotics? Recalling our last discussion, what are the antibiotics? Anyone who can explain that? Stop infection, the kill microorganism, drug against. If I ask you that what is the difference in between antibiotic and antiseptic? Drug against bacteria. This is a very small tip about that inhibit the growth of destroy the microorganism. Both are destroying and both inhibiting the growth of the microorganisms. What is the main difference in between antiseptic? Antiseptics directly killing the bacteria from outside, and as Usama Asif is slightly right about the antiseptic. No, the antiseptic, we have other ointment and paste which are antibiotics, and we are using it. So only this definition is not enough that we are using antiseptics only topically. We are using antibiotic also topically. But main difference is that all those chemicals which uh, enter into the blood group, bloodstream, and then reach to the cell, inside the cell, and they disturb cell wall or metabolism of the cells and kill them. Antiseptics are those that they are only just straightway affecting on the cell wall, outer surface of the cell walls, and they are destroying the bacteria. So all those chemical or the compounds which are directly killing the bacteria from and affecting on the cell wall of the bacteria or a normal cell outside on the outer surface of the cell wall. But these antibiotics, they always affect from the inner side of the cell. So and there are the antibiotics which are affecting on the cell wall, but inner side of the cell. Like, and or some antibiotics are there, those who are affecting the RNA, DNA, or metabolism of the cell. So all those chemicals which are uh, destroying the cell from inside of the cell are known as the antibiotic, and all those they are affecting on the outer surface of the cell are known as antiseptics. So we are concerned here in dentistry. There is a very slight role of antibiotic. Because if in a gum infection or in a tooth extraction or in any infection, if we are prescribing antibiotic, I doesn't mean that we are not prescribing this antibiotic. When I say there is a very, very short role of this, because when we prescribe antibiotics, we will wait. That antibiotic will go each and every cell of the body, even in the bacterial cell also. They kill the bacteria and they also affect the normal cell metabolism or their cell walls. But there is a defense mechanism. By phagocytosis, our normal cells are less effective, but bacterial cells are more effective when we are prescribing antibiotics. But in dentistry, if we are using this mouthwash or dressing or cements or anything, in that there is no role of antibiotic. There is a role of antiseptic. That means normally we are making materials in dentistry using antiseptics, and there are so many compounds, uh, dyes, oils. They have the antiseptic qualities, and that they are we are using in dentistry. So last time I discussed about the halogen group, and I told you which uh, this normal compounds we are making with with this group, and which types of disinfectant we are making to use in endodontic therapy. Because enamel is a dead tissue, dentin is slightly alive tissue, but in nerve or in pulp, we are dealing uh, with a normal live tissue. So we are making normally these drugs for pulpal purpose. Uh, that means this halogen group is very effective group, and its quality that it breaks down into other compounds when it is it is combining with the proteinous material, and is very, very effective and very effectively used in endodontic therapy. And we can disinfect these instruments and other cabinets and all these things with this group. But there are the little drawback into this. For that, we are making normal iodine to iodophores and in iodoform. Iodophores are normally those compounds in which we are adding some these ammonium group, which has a detergent quality. We are adding and mixing it, and we are increasing the efficacy of that particular halogen group. Then we are in iodoform, we are mixing this formalin group, which is a very good antiseptic group, and we are making this iodoform, and with that we are using it in disinfection of the root canal, and we are making so many material. Then eosol, we talked about that have hypochlorite and chlorine compounds. They are very much effective, and this combination of these drugs and material of these drugs are available in the market, and we are using in dentistry. Then sodium hypochlorite solution for irrigation of the canal, and chloramine also. This chloramine also we use in 2 to 5% we are using in endodontic irrigation or disinfection of our water tanks or other instruments. All these compounds we can use for disinfection also. Instruments and cabinets and other floors, we can use them. But if um, we are using to disinfection of some clothes or some paper made things, there will be a discoloration. If we are disinfecting these instruments, and we are using this iodine group or halogen group for disinfection of the instruments may be stained, But we know this, that this is the only group which is effective against viruses also. And it is a very good compound when we feel that there is chances of availability of these viruses, then it will be an ideal one, and we are using it against viruses. And all these compounds and all these this halogen group. Now, next group, which we are talking now today, is a quaternary ammonium compounds. These are these compounds, ammonium compounds, have the detergent quality. They are very good antiseptic because these compounds are killing the bacteria. But they have the quality that they they, they 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 act as a detergent. And so many preparations are available in the market for this. Um, there may be a one very popular one, we can say benzyl conium chloride, and it is available in the market with the name of Rocal or Saffron. It is a 0.1% solution of the drug has been recommended for irrigating the pulp cavities after traumatic exposure. And it has a quality to wipe off every fragment from the canal. Or we are using this alone also, and it is very effective against the gram-positive and gram-negative bacteria. It kills. It's a it has a bacteriostatic action. Static action, and we are using this drug abundantly in dentistry, or sometimes its sprays are available in the market when we have a sore throat, and spray of this throat. This detergent quality is helping us to wipe off all the pus and this infected material from that particular wound when we are using this directly onto the wound. And these ammonium compounds are very effective one against against all gram-positive and gram-negative bacteria. And benzyl conium chloride, this is available. Its sprays are available. It is available as in the bottle. But remember one thing: these ammonium compound, we cannot we are putting this into the glass bottles, but we are not using the cork stoppers for that, because if we are using the cork water stopper on that bottle, that will be rusted, and that will be that will not be um, helpful for us to stop any evaporation and other things. So another compound of quaternary ammonium compound is laurelinum acetate. That one is, the other compound is benzyl conium chloride, 1% available in the market. Laurelinum acetate, 5% with alcohol we are using. This is a good detergent and very good antiseptic and available in the market. And alcoholic solution is helping us to kill the bacteria. And we are using in dentistry, especially when we are making this mouthwash. It is very helpful in the mouthwashes, and in case of necrotic gingivitis or all that, it is a very effective. It is making a very effective this. Uh, then we have one citramide aqueous. It is available in the market with the name of catavilon, and this is 0.75 to 1% aqueous solution of citramide. It is also a very good detergent, and we are using in dentistry and in normal sore throat. Our on medical side, all these drugs are available, and they are using it while we have upper respiratory tract infections, and we are using this directly to help and to kill the bacteria and to help in medical sciences. And then dequalinium chloride 1%. It is available in the market with the name of Dequadine. So these compounds, sometimes we are using them alone, and or we are mixing it with the other antiseptic groups and having and achieving our recommended properties from those materials. So when we are adding these ammonium compound with the halogen group, so it will be a very effective uh, antiseptics, because these ammonium compounds are also good antiseptics, but they are the detergents. And halogen group, it is breaking down, but and we these detergents are helping us to overcome on the problem of that halogen group, that they are staining uh, that particular surface. So these detergent, when we mix with that, we will overcome on the problem of stain on in that particular uh, uh, material. So in operation theaters, for disinfection of the our hands, our table, our skins, or operation sites, we are using these materials, and and especially to clean the oral cavities, we are using the mouthwashes of these, and cleaning uh, that particular area. Then another group, which is of antiseptic, is we know this, that another one is the phenol group. You know, we are familiar with this. These are the antiseptics. They coagulate the bacteria. You know, previously I was talking that they detergent. They are the detergents. The ammonium compounds, they are the detergents. They wipe off that particular thing. But phenols, phenols are very strong antiseptics. It is effective uh, against some viruses also. Not all, but some viruses also. And its quality is this, that they coagulate the proteins. Especially, we are making mouthwashes of these phenol group. When there is a bleeding gum or a bleeding area anywhere, this compound is very effective because it coagulates the normal cell or bacterial cell or any proteinous material, and that coagulation helps us to stop bleeding and other things. These phenol group, we are using them to disinfect the clothes also. And the preparations available in the market, phenolic disinfection, is camphorated paramonochlorphenol. CMCP is an ideal disinfectant which we are using abundantly in dentistry, in endodontic therapy especially, or in all that areas where we feel that there is uh, uh, bleeding or proteinous material or pus is available. So this is a very effective antiseptic group which we are using in dentistry. And thymol, you know, uh, it's a one solution that is known as the Hartmann's solution we are using in dentistry. And thymol normally, let me tell you, the mouthwashes of this thymol is available in the market, and uh, normal, I think, uh, mouthwash which we are abundantly using in our daily routine is the Listerine one. It is also a thymol which we are using. In dentistry, we are making the mouthwashes of this phenol group, and that is effective against the bleeding gum and necrotizing gingivitis also. In endodontic also, we are disinfecting our clothes, especially with this chemical, and um, hexachlorophene is also one important compound of in phenol group, which we are using. Then chloroxylenol, 4.8%, and it is familiar in the market with the name of Dettol, and available, freely available. We can use all these compounds to disinfect the mouth, disinfect the cloth, disinfect the instruments, disinfects everything. And its property that it is coagulating the proteinous material is very helpful for us. That 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 coagulates, helping us to to stop bleeding and exudation in the cavity. Then chlorhexidine. Chlorhexidine is available in the market with the name of Habitan and Savalon. Savalon, I think with these two names, everyone is very familiar with these two. The Savalon we are using in operation theaters. Also, Habitan is a very good mouth disinfectant. We can use this into the oral cavity, and it is the ideal material for disinfection and killing the bacteria. And we are using in other materials also. And with the combination of ammonium compound, um, and with the combination, these phenols we are using with the combination of halogen group also, when combining these two and having the properties of these two and killing the bacteria, that is very much effective in dentistry. And we can use them alone, we can use phenol and all this. Here, let me tell you one thing. This phenol has a coagulating property. You know, the composite, it is a main ingredient of the composite, bisphenol, methyl methacrylate. So we are mixing this. That methyl methacrylate, you know that is your acrylic ingredient. And when we are mixing it with the phenol by bisphenol, two element of this phenol, it will be giving us a very ideal material for filling for anterior filling. So this is how we are making all these chemicals which I am talking today are the chemicals with which we are making the dental materials, or in any way in one or in one type or in another type, these manufacturers are using these materials and the properties of these materials. So this phenol group we are using in dentistry, and in these days we all are affected by the one virus is known as coronavirus. I talked about halogen group. I talked about this ammonium compound. I talked about phenol group. These three groups are very, very important in these days. And it is, I'm surprised for this, that why the doctors are not recommending the patients to use for use of these three groups. And knowing this thing, every medical doctor knows this thing, that entrance way of this bacteria is mouth and nose. But in any discipline, I have not read that they recommended any corona patient for mouthwash of this. These are very effective mouthwashes, but they are not recommending them. They are recommending mask, not mouthwash. This is very much surprising for me. And in my one radio, this interview, I told that them in Radio Pakistan interview. I told to the nation that it is very important and it should be included into the protocol that this mouthwash is very much helpful for us. And a combination of halogen group with detergent ammonium compound or combination of ammonium compound, phenol, and that, it is effective, most effective way to kill this virus. But we are not recommending the mouthwashes of these chemicals, but we are recommending, and everybody is using Sanamaki also. That is very strange that all educated people also they are using this that Sanamaki with its very negative effects. I don't know why they are using it. So next, we talked about this uh, ammonium compound, phenols, related substances which we are using in this, and the next antiseptic quality which we are using in making uh, next we are using dyes. Dyes, there are some coloring agents. They have a very good antiseptic quality, and that quality of these dyes are helping us in our dental field. Acridine 1 into 1000 solution. This is a very good dye with and having a antiseptic quality. And you know this aniline solution, gentian violet we are using in mouthwashes and killing the bacteria and as a disclosing agents. And these dyes are helpful for us in a dental field. You know, trichloroacetic acid 40% and chromic acid 5 to 20% also it is providing us very good uh, antiseptic qualities, and if we are using into the oral cavity. And this aniline and uh, gentian violet, we know this, that is a non-irritant material, non-irritant dye, killing the bacteria, and uh, very effective in oral ulceration. We have so many preparations available in the market against ulcers, mouth ulcers, and we are using these dyes, and we are using these dyes as a disclosing agent also. Uh, uh, they are very effective and very effective against gram positive cocci and gram negative bacilli. And uh, we in oral cavity in ulcerations, we have these types of bacteria, and these are very effective antiseptics when we are using um, them. And these dyes sometimes we need in operations on the skin to mark the areas, and these dyes we can use them because they have the antiseptic quality, and we can use them on the skin, and we can mark the areas, different areas when we are operating any particular, especially when we are operating TMJ and we have to mark uh, the areas of head of TMJ on the outer surface. We are using these dyes, and they are very permanent, leaving permanent this staining. And then we can say that there are acids also. Chromic acid we are using. Chromic acid, uh, every acid is killing the bacteria. But there are the acids with all acids, they are not killing all the bacteria. But these are the acids which that we have, they are very effective against gram positive and gram negative bacteria. And trichloroacetic acid 40% and chromic acid 5 to 20%. They are very effective uh, acids which are killing the bacteria. And here they are antiseptics. They are killing the bacteria. We are using them, but their quality, one quality is a paralyzing that particular tissue. Now, if I ask you that what is paralyzing, what is the meaning of this that it is paralyzed? Oh, किधर गया? Can it, anyone can who can comment on this that किधर से आएगा इनका? इनकी चैट ओपन करना जरा. Yes. Desensitize, antibiotic नहीं. If I say this one is a paralyzed, what do you mean by paralyzing agents? We can say that these acids are paralyzing agents. Desensitization, not working. This, it is not working. In paralyzation, we can say that um, the tissue or the part is paralyzed, mean that is not dead. There will be a blood supply, the maintenance of the blood supply and life. Loss of function, yes. Not working, loss of functions, but not dead. So these two acids, when the use of these two, they are very strong antiseptics, but they are the paralyzing. When I say antiseptic, they kill the bacteria. When I say the antiseptic, they are killing the bacteria in a way, and they are that antiseptics are also killing the normal cells also. And but these two acids are helping us that they are not killing completely that particular bacteria or particular tissue. They paralyze that. The life will be there. And this quality is helping us in dentistry when we need to paralyze any particular area, especially in root canal. Because root canal is a very, or sometimes we want to um, uh, paralyze the gum functions so that there should not be any pain or any problem. But after some time, that starts functioning. So these acids are the antiseptics with the paralyzing qualities. So we are using it in dentistry and making the material. And here, when I told you, I showed you this uh, function that we need sometimes analgesics, sedatives, or anesthetics. So these material is helping us. So in one very important area, they are very effective. When dentine is naked, enamel is wiped off and dentine is naked, or root is naked, that is very much sensitive. To overcome onto that problem, the touching of this chromic acid or all this is paralyzing the dentin, this dentinal area, and relieving the patient's problem. So we are making these, we are keeping help from these two materials and using them to paralyze that particular, especially the dentin. When we are dealing with the sensitive dentin, in coming days, you will you will feel this is the most problematic uh, uh, disease of dentistry. And these two materials, if we are using these two acids to paralyze that particular area, is helping us, and we are making them, making all the materials with this. Then, uh, you know, then we are using, ये क्या है? ये कर दूं. Then I talked about the acids we are using. Then we are using silver salts also. Silver nitrate and tannic acid uh, we are using to in dentistry. They are these two silver salts are very good antiseptic, very good antiseptic. And they have the quality of astringents. Astringents, uh, anyone can comment what are astringents? हाँ, ये किधर से आएगी चैट इनकी? फिर गायब होगी. We can use these. Silver nitrate is a synthetic salt we are making, but vegetative is the tannic acid. In a way, we can say that this tannic acid astringents. What do you understand by astringents? Why we say in a case every antiseptic, every compound which is known as an antiseptic one is a astringent. They shrinks, constricts the body tissue. Yes. And yes, you are right. Fatima Zahid, you are right. This is causing the contraction of skin. Yes, this is a property of that. So we are concerned with these are two materials. Silver salts are there available in the market, and we are using it in dentistry. Astringents are those compounds which kill the bacteria. They coagulate, they precipitate, or they oxidize that or deoxidize. You know, antiseptics have their properties. There are different ways of killing the bacteria. Some antiseptics they coagulate. Some antiseptics they precipitate. Some antiseptics are there which oxidize that particular area, especially when we are talking about anaerobes. And some are there they are deoxidize that particular area. So there are different actions of these chemicals, and we are using in dentistry according to their actions. So astringents are those compounds or those salts or those acids or those antiseptics which coagulate, precipitate, deoxidize or oxidize the area, and they leave hard layer. You know, in other case, in phenol group, there is a coagulation and that will be wiped off. There is a halogen group. They will break down the proteinous material and they break down into the different compounds and pipe off. But these two silver salts are helpful in dentistry. They are strong antiseptic, having a quality of astringent. Astringents are all those, they contract, they coagulate, they precipitate, but that precipitate or coagulate material stick on that surface. And with that, especially in sensitive dentine, if we are applying this onto the sensitive dentine area, it is coagulating that dentine, coagulating the dentine tubules also, and other this nerves endings running into that. They coagulate all that and they produce one layer. That layer stick on that area. And it is very helpful in dentistry when we are making some pharmacological compounds in the sensitivity of the tooth. There are mouthwashes available in the market, and we can say that they are with mild silver nitrate or mild effects of this tannic acid. These mouthwashes are very much helpful for us in sensitivity of teeth. And all these dentifrices which you are using in the market, they have these two compounds into that, and they said it is very effective. In 1 minute it is giving, and in a second they are relieving the sensitivity of your mouth. They are using these two compounds into their dentifrices, into the mouthwashes, and with these astringents we are using. And especially, let me tell you, all the students, that in old times, we were using one that is called Dandasa. Dandasa is also one form of tannic acid. And remember one thing, I'm giving you a very important point, that this tannic acid is the only dentine um, um, uh, desensitizing agent. And we can, if we say what is etching agent of dentine. Dentine, etching agent of dentine is the only compound that is a tannic acid. And all these manufacturers, they are hiding it. They are using this tannic acid only, and selling it into the market that this is a dentine etching agent. So this tannic acid is a very important compound in dentistry, and we are using so many uh, uh, materials in dentistry, and with the quality of this astringent. So astringents have a very important role into this, and normally we are using these two only: silver nitrate, which is a synthetically originated compound, and other is a tannic acid, one which we are using into the. Then another one, hydrogen peroxide. Hydrogen peroxide is the only compound. We are making so many uh, compounds and for so many materials in dentistry, especially the bleaching of teeth. You know, this compound has a quality. This is a very strong antiseptic, killing gram positive, gram negative, and especially the anaerobes. Because when we are using this hydrogen peroxide, it with in the combination of this proteinous material, it gives bubbling in that area and supply a nascent oxygen. And all those mouthwashes, which when we feel that there are the deep pockets available in the mouth, and we need oxygen over there, we are using this hydrogen peroxide mouthwashes. And the bubbles of this hydrogen peroxide, when we are using it, when it react with the proteinous material, it gives a bubbles, and that bubbles kills the anaerobes when we are using and mouthwashes are available in the market. Or we can use this at 2% dilution of this particular, or 3% dilution of this. It is giving us a foaming bubbles of oxygen, and this is the only and only compound which we are using in uh, uh, discoloring or bleaching of tooth and anything, because it oxidize that particular area, and this oxygenation is helping us. And all the compounds of bleaching compounds in dentistry, whether it is a home bleaching or all that, that is a derivative of hydrogen peroxide. And this compound we are using in the irrigation of the root canal also, disinfecting the root canals and all this. Because when they're in deep root canals, or uh, that old affected canals, there is a chances of anaerobes also. And when we are using this hydrogen peroxide irrigation into the canal and using the material into the canal, this hydrogen peroxide is helping us. We can disinfect the uh, um, instruments also into this compound, and we are disinfecting also. This hydrogen peroxide is helping us when we are cleaning or disinfecting the diamond burrs, because there is a dentinal chip gauged into the diamond chips, and when we are putting these into the hydrogen peroxide, the oxidizing phenomena is helping us to clean that particular area. And with these qualities, we are using this hydrogen peroxide in dentistry and making the materials. Then we have formaldehyde group, formalin. And this we can say is a mummifying agent. Is it a very good, and this formalin, you are all aware of this. There is a one problem of this, that its vapors are very much annoying, and its smell is too much. That is why this is a very strong antiseptic, killing all type of bacteria and viruses. And but use of this particular material is restricted because it has a very plunging smell, and is very annoying for us when we are using it into the surgeries or this. But this is a very strong mummifying. Now, if I ask our students, what is mummifying agent? What do you mean? What do you understand by mummifying? What is this process? Mummifying. Anyone of a student? Mummifying preservation. Shanze Farhan. Anyone else? Dead body, dead body conserving, preserve. Yes, in a way we can say that we are preserving it. But what is this phenomena? How we are preserving the dead body? What is a phenomena of uh, by which we can say that this is why the dead body is conserved? The bacteria. Yes, almost. This can we can say, Osama, by applying chemicals. What is the effect of those chemicals? If I say that we are applying these chemicals, but what may be the effect of those chemicals? Okay, all right. Will you tell me, please, how a body degenerate? How one body or one tissue de- degenerate? You know, when person is alive, or anything which is alive, there is a self-defense mechanism in it. The body is always attacked by the bacteria. There, not only this, that degenerated. My question was that what is, how it is degenerated. Body degenerated, how tissue degenerated. That let me tell you that bacterial attack is continuous on our body. There are so many bacteria always running into the blood, into our stomach, into our tissues. Our self-defense mechanism, abnormality of biochemical function. Which abnormality? So listen to this. You know, our self-defense mechanism is helping us to kill all unwanted bacteria into the body. When a person dies, the self mechanism stops. When it stops, all bacteria, they became machinery, and they started producing toxins. Bacteria itself is not a thing to degenerate any body or any tissue cell. Its toxins are responsible for degeneration of our normal tissue. So if we stop bacteria to invade, or another defense mechanism in a way, the body will not degenerate because there will be no bacteria, there will be no toxins, and there will be no degeneration of the body. So what we do, we are injecting this formalin into the tissue, and after injecting so many uh, amount of this formalin into the tissues and kill the bacteria, then to avoid the chance of further bacterial invasion into that particular body, we put that into the, and we dip it into the formalin, and that tissue will be preserved, and that is known as a mummifying. You know, the old, these mysteries and all those, they know this process, that how they can stop bacterial invasion. And if we examine that how they preserve the, you know, they put some antiseptic very strong. They were not aware of this, that formalin is the best one and we can put a tissue into that. And you have seen in pathology museums that we are putting this organism or organ of the body into the, and we are dipping it into that, and this will be artificial um, uh, stop of bacterial invasion into that tissue. And if we can stop bacterial invasion, there will be no toxin of bacteria, and there will be no degeneration of the tissue. So this formalin we are using, especially in mummifying of the tissue. So this group is very effective group, and we are using this in dentistry, not into dentistry, but also we are using in uh, all medical uh, sites. And this we call, this antiseptic is a mummifying agent. We are making some solutions when we feel that there is some problem for us in, especially in um, the pulpal tissue, and we cannot go for normal conventional root canal therapy. We mummify that particular area by applying this particular formalin group. And this is a good antiseptic. We are using it in disinfection of the canals also, this formalin. And we are putting this formalin preparations into the, with the paper point into the root canal. And it is a very good Uh, Especially the vapors of these formalins are very effective against the bacteria. They are also killing. And sometimes we are using this to the vapor we are using them for disinfection of our instruments and bones and all these things. This we will discuss later on in another lecture, that how we are using this formalin or other antiseptics to disinfect our instrument and or other surgical items, which when we are using these. So this formalin group as a mummifying agent is a very effective group, and we are using in dentistry in so many aspects. In so many aspects. Another is uh, essential oils. There are oils which we are using in dentistry and making the material, some uh, preparations for dental treatments, in which we have clove oil, eugenol, canjuput oil, eucalyptus oil. All these oils are very, very good antiseptic. We normally say that if there is a plant of a eucalyptus in your house will be in a condition of aseptic. So these oils are very effective one, and we say that they are the obtundants. Obtundants are those antiseptics which are oily, and they are strong antiseptic and have a quality of sedation or pain relieving. Using this eugenol it's a good pain reliever, good antiseptic, and when we need some therapeutic uh, 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 needs, when there is pain into the tooth, we can use this particular cement or particular material to relieve the pain. Clove oil have a property of sedation. Then its compound of this clove oil, which is called eugenol. That eugenol is a very effective pain reliever, very effective antiseptic, and we are using it in making a zinc. We are mixing it with the zinc oxide and having a very, very effective, very effective cement for dentistry. And your dental uh, laboratory is not completed. Your dental clinic is not completed if you have not in the clinic zinc oxide eugenol. Kanjuput oil is also a very good, effective pain reliever. And all these oils, essential oils, and these are the volatile oils, they evaporate also. And these uh, are known as obtundants, which we are using. So remember these, all those antiseptics which are pain reliever, antiseptics which are pain reliever, known as obtundants, and we are using in dentistry, and we are making so many compounds. So दो बज गए, बस कर दे. So students, next time again we will discuss about next next time inshallah we will be discussing again for that. And now it's a time if you have any question about uh, lecture of this अगले Wednesday. Okay, sir. Is we use acid if caries is present? use of acid when caries are present. You know, acid also kill the bacteria. But normally we are not using acidic medicine when there is a carious process, because it will increase that process if we are using. Caries are because of acidity. Yes, acidic media also dissolution the enamel and dentine. You are right, but use of the acids, antiseptics, uh, that chromic acid or tannic acid. Tannic acid is also relieving pain. We can't say that it is a strong attendant, but we can use this. But it coagulates the area. And it has a very good astringent. It is giving us a hard layer. But if we are making a hard layer of infection or a carious one, again there is a chance that there will be dissolution beneath that particular hard layer. So we are not recommending acidic media when there is a carious layer uh, in that, and we are not making any preparation which is acidic one when we are giving lining or a filling material into a carious area. So it is clear. Okay. Okay, now next Tuesday, inshallah, we'll again continue with this story of dental materials, and we'll discuss it again. And right, thank you. Okay, Khuda Hafiz.